Hello, my name is Cameron, and one of the reasons that interests me in becoming a sonographer is the fact that when I was born with a small hole in my heart, which was detected through an ultrasound. So I spent a lot of days growing up going to ultrasound appointments to check on the size and the progress of the hole. That personal situation is part of my interest in becoming a sonographer. And many times people who are experiencing an issue get an ultrasound done as one of the first steps in diagnosing the problem. In regard to my healthcare experience, at the beginning of 2021, I started volunteering at a local hospital in Kailua called Adventist Health Castle. I started my volunteer journey on the COVID clinic, where we were facilitating patients' paperwork, and also giving the shots for the vaccine. I also volunteered in the call center there, in which I answered patients' questions and concerns regarding appointments and the vaccine. A few months later, I transferred to the med-surg floor in that hospital. On this floor, we acted as like the right-hand man for CNAs, nurses, and doctors. I developed skills such as bathing patients, feeding patients, transporting patients, and assisting patients with their requests. When I wasn't in the patients' rooms, I was at the nurses' station answering phone calls, sanitizing, and restocking supplies. I ended my volunteer journey in the ICU. I performed similar duties here as I did on the med-surg floor, just with higher risk patients who were definitely more sick. And throughout the two floors, I was able to assist and witness several procedures such as cardioversions, lab draws, ultrasounds. The lead ultrasound tech was often in the ICU, and I had the opportunity to help him a number of times doing scans for patients. This is where my desire to be in the field really flourished and became hands-on experience that I'm so blessed for. He mentored me with how to explain the process of the scan to patients and guided me with where to use the transducer and when to snap images. In that same hospital for the past year and a half, I've been working in the admitting department. In this job, we are exposed to so much and assist nearly every department in some form. We register about 250 patients for outpatient appointments every day, and as policies and procedures are always changing and we are constantly learning and adapting, I believe that will be beneficial to me in this program because I'm a fast learner and can adapt in a fast-paced environment. I also have experience in caring for patients who are frustrated or emotional. In this position, I'm the first person who they encounter in the hospital. I've always acknowledged that I am there to listen and show compassion and empathy. And being inside a hospital and receiving care for themselves or their loved one can be scary and emotional. And being that person for people to cry with or chat or share their concerns with has been an honor. I have experience working with sick and dying patients in my hospital's med-surg and ICU unit. I started volunteering and working in the hospital during the height of the pandemic. Sometimes I think that the world and healthcare gives more attention to the beginning of life, which is so beautiful. But as people are sick and dying, it is equally as important to support them. I want them to feel like their wishes for care are being honored and respected, and that they feel like their overall well-being is being nurtured. Some really impactful experiences I have had with patients in this group include being invited to their room, sometimes when they are alone, or other times when they're with their family, and being asked to pray. Because my faith is such a pillar in my life, it was always a touching experience. Besides for the faith part, for me, praying for someone symbolized the union of our voices and our hearts, and my desire is to bring peace and comfort. My philosophy with patient care is that we meet people where they are. Patient care should be what the patient needs, and as healthcare professionals, we are the warriors for our patients and being sent to battle to advocate for their current and future health needs. Like I talked about in my essay, being from Hawaii, family is another big pillar for me, and I wanted to feel like people are being cared for by their family, by people who love and care about them. In regard to specialty areas, they got their names from the general anatomy that they look at, which is one of the biggest differences. Cardiac sonography looks at the heart and within the heart, so the chambers, the valves, the blood vessels. And general sonography covers the abdominal organs, the woman's reproductive system, the fetus. Vascular sonography examines the blood flow through arteries and veins. And sonographers use the machines to turn the sound waves into 3D images. And because they're captured in real time, it can show movement. Depending on the specialty of choice, sonographers may work more heavily with certain population groups. For example, echo sonographers may work more heavily with geriatric group or young kids, and depending on what group of the population you mostly care for will require different interpersonal skills from the sonographer. The specialty that I want to go into is general. There's so many vital organs you get to study, which is super cool and also daunting. My goal is to work specifically in a women's clinic after getting my degree. When I was getting my undergrad, I took a research class, and my professor was an author and a midwife in Mexico and California. And in this class, we examined the socioeconomic and environmental impacts that affect access to healthcare during womanhood and motherhood. And what I learned was both sad, but also inspiring at the same time. Our research made it so evident to me that socioeconomic factors were affecting their ability to receive care prior to their pregnancy, which did result in troubled pregnancies sometimes. It really fueled my fire to want to advocate for women's healthcare needs. I am excited and optimistic for my future as a sonographer. One challenge that I know I will see is doing scans for patients when you find out the health issue is terminal. As the empathetic person I am and someone who so freely welcomes emotions, I'm confident that I can show empathy while maintaining a level of professionalism. I'm also super blessed to have a good support system in which I can lean on them when I'm struggling. Thanks for listening and allowing me the chance to show you all a little slice of my why for this career. My overall goal is to be someone who shows grace to people on a day that may not be their best day.